Okay guys, the next two conditions commonly seen in oral medicine clinic are patients with TMD as well as patients with xerostomia. But before that, a piece of advice from me. In oral medicine, we treat patient uh, as a person, okay, not only as a patient. Uh, Not only that we have to make a correct diagnosis and give medications, but as well as we have to think about their environment, their backgrounds, what are their obstacles in order to follow our advice. um, and sometimes you yourself need to stop for a while and smell the roses, smell the flowers, go around and have a good view of everything surrounding yourself. Okay, stay calm and be focused, right? So shall we start with the first one, which is patient with TMD. Okay, for me, TMD patients can be quite easy to diagnose and treat, and it can also be very difficult to treat because there's a lot of elements in this condition. Patient might have some psychological factor relating to this condition, might have stress factor. Sometimes it is coexist with atypical facial pain. Okay, that's quite difficult to treat, right? So the most important thing is to derive to a correct diagnosis. Okay, how do you do that? I already showed you how to examine TMD patients. One of the important complaint of patient with TMD is having difficulty or having pain during chewing food. Okay, this is a chronic condition and its recurrence. Okay, patient might get fed up. Okay, because it's come and go and come and go. You yourself have to advise patient, have to calm the patient down. Okay, and after you examine the patient, please rule out all the dental factors, rule out all the dental caries, periodontal diseases, those that can cause pain at the orofacial region. Same as you treat other facial pain conditions, yeah, like TN, atypical facial pain. Okay, you have to rule out dental factors, right? So do a good END examination, and after that you can order OPG and TMJ view, right? And then for treatment, okay, we have various treatments for TMD. Okay, we have cold pack, we have physiotherapy involving ultrasound, diatomy, and various others. Okay, and we also have splint and also medications. Okay, so which one to start first? You always start with the conservative regime first. Okay, conservative regime first. What are the conservative regimes? Soft diet. Be very detailed about the type of food that is categorized as soft or hard food. Okay, give example to patients so that they can visualize. uh, Another one under conservative management is limit mouth opening. Okay, and a hot pack is also considered conservative management, right? Hot pack, if patient doesn't know what is hot or cold pack, show the picture of that, and you have to advise patient to use hot pack 3 times daily, 20 minutes per sessions. I keep on repeating the same thing again and again, but there will always be students that uh, do not know the duration of using hot pack. Okay, so be very very good at giving advice for conservative management. If the patient is not improved with conservative management, you can start maybe referring them for physiotherapy. Okay, and you must specify the region so that the physiotherapist knows where to do the treatment. Okay, and for how long, the durations. There's a form always, there will always be a form from the physiotherapist. Okay, fill in the form, your instructions and the durations. Yeah, right. And then for spleen, if for example if there is bruxism involved in this condition, the TMD condition, and if you see some tooth wearness, especially the attrition, and if you think the conservative is failing, the medication is failing, you can start with spleen. But spleen is usually not the first line of treatment in the school of thought that I went through. Okay, but in Japan, they like spleen very much, and they don't like soft spleen, they like hard spleen. So TMD, there's various school of thought. Nobody is superior than anybody else. It depends on the patients actually. Okay, and also if you have came across the word CBT, cognitive behavioral therapy. In Malay word is rebel. In other words, patient have to accept their conditions, it's recurrence, it's chronic, and do the conservative on and off, right? Okay, so during review treatment, whether patient is improving or not, you have to customize during according to the patient's need. Okay, it's quite tricky to manage TMD, and if during the first visit patient complain of pain, and then you maybe saw some inflammation in terms that there's some redness, for example, at the temporal region, you can start with medication. For example, you can give NSAID, ibuprofen. Okay, and sometimes some clinician also prescribe analgesic for the muscle or diaphragm for the muscle. Okay, and the next condition is commonly seen in oral medicine clinic is xerostomia. Okay, how do you know that the patient has xerostomia? For example, if you put the mouth mirror inside the mouth at the buccal mucosa or on the tongue, the mucosa is sticking to the mouth mirror, or you see a frothy whitish saliva, okay, and also consistent with the patient complaint. You will see a lot of patients with xerostomia because this is a common side effect from various types of drugs. You can't really ask the patient to stop the medication they are taking because it might jeopardize their life actually. Okay, so xerostomia is a treatment, palliative treatment. Okay, focusing on the palliative treatment and consoling the patients that sometimes this side effect is kind of difficult to manage. Okay, usually we will give mouthwash. So what are the names of the mouthwash commonly prescribed in oral medicine clinic? I hope you know the names. Okay, and if there is a symptom, for example, patient complains of itchiness or burning sensation associated with xerostomia, please do smear or swab to rule out candidiasis. Okay guys, see you in Telegram. Bye.